Hi, my name is Dilpri, and today I'll be shooting an exam video for class 320. Just to let you guys know, I do have all the notes pulled up for Kim Sean K, and I'll only be looking at these documentations provided for our exam and nothing else. Okay, so let's go ahead and get started. So today, the first thing that we're going to be seeing is patients, not the screening form. We're going to be doing the MRI requisition. So we're going to make sure everything is filled out. Surname Kim, first name Sean, gender male, date of birth 1974 07 21, height 174, weight 84. Everything is seen perfectly, right? So we're gonna make sure that we look at the examination requested, which is gonna be the MRI brain without contrast, and we're also gonna look at the diagnosis code, which is R51 headache. And we're also, the second thing that we're going to look at that is very important to us, we're going to make sure that the form is always usually has three things. That it has what the procedure is for. Sorry, more than three things. So what the procedure is for. Again, examination requested. So it's going to be the MRI brain. And then the second thing is going to be the diagnosis code, R51, and then the signature of the radiologist or the doctor or physician, whatever it is. Yes, physician. So right here, it looks like the physician has signed, and you also want to make sure that you have the patient's full name, date of birth, and everything. So that way, when you do call the patients in, everything is correct. So the next thing that we're going to be looking at is going to be the implant card. So let's go ahead and pull it up. So right here, the first thing that you can see that it's a Cobra PZF, and it's manufactured. I can't really read. It's a little Silo Nova Bioscience. So again, it does say that it is MRI conditional. It reads out everything. Magnetic field is 1.5 to 3 Tesla, and it does have the stent implant card and all the information, but for our own safety, we're going to be going ahead and going to the mrisafety.com and looking for ourselves. So I'll go ahead and type that right now, mrisafety.com. Okay, so it's perfect. We're here and we're going to find the list. Now, I have the site pulled up right here. It says the list record number is going to be 7039, and the strength, it says, is 1.5 to 3, and object status conditional 8. So this is MRI safe, since we are going to be running the test with our machine, which is 1.5. So perfect. Okay, so the next thing that we're going to be doing with the patient is setting up the room. Now, the patient isn't here yet, but we want to be set up in advance. So the first thing that we're going to be doing is, again, looking at everything at the form. So again, it did say that it was a MRI brain without contrast. So we do not need an injector, but we will be needing a head coil. So we'll go ahead and bring the head coil into the room, and we're going to bring in some pads as well to make sure the patient is comfortable, and we're also going to be bringing in a squeeze ball and some headphones for the patient. Once that's in, we're going to go ahead and sanitize everything that the patient will be coming in contact with or laying down on, and make sure that there's clean linen and everything. So after that, everything is prepared and ready for the patient. We're going to go ahead and see if the patient arrived. Now, when the patient arrives, we're going to go ahead and make sure we don't call his name yet, even though it's Kim. We're going to go ahead and just say Kim for now, and we're going to head and see if he is here. Once Kim comes up, we're going to go ahead and just confirm. So we're going to ask him for his date of birth, which should be 1974 07 21. So once Kim comes into the door and he gives us his identification and everything is going to plan, we're gonna go ahead and let him know that, hey, I'm Dilpreet, I'll be your technician today. And yeah, so I just want to let you know that the exam is gonna take about 30 minutes. And so basically, what's gonna be going on in the exam is we're just gonna be doing an MRI of your brain. I'll let you know more once we're inside of the room. And I just want to say thank you so much for showing up today, and it means a lot. And again, if I don't ask the date of birth or the identification before that, I'll go ahead and ask now. And then after that, I'll go ahead and have him go into the room. Now, once in the room, we're not going to be looking at the screening form, which I am looking at right now. We won't want to look at that screening form just yet because we want to make sure that everything is already, secure before even going on to the screening form, because I believe that we shouldn't distract the patient. So we're going to go ahead and let them know that everything should be off and set into the locker where we can lock it. But it'll be something like this, like sorry, I'm just panicking a little. Hi, my name's Stoker. Again, I already said that. I'm not gonna start this video over. So what we're gonna have you do is we're gonna have you take off all your clothes, and you're gonna go ahead and put it into this locker. Make sure that there is no jewelry, no watches, no cards, keys, glasses, anything that might come in that you aren't allowed to bring in besides a gown and any other medical device, which you probably won't be bringing in because, okay, I probably won't say that. I'm just going on now. Again, everything should be in the locker room, keys, watches, everything like that. And I'll bring the patient two gowns, one for the front and one for the back. I would go ahead and also bring them non-slip socks, and I would let them know that, here are the two gowns, one's for the front, one's for the back. And once you're all done, go ahead and lock your locker, and I'll be, right outside the store, and we can talk about the screening form. And I'm gonna go ahead and pull up the screening form now. Okay, so right here. So right now I'm looking at this screening form, and I'm just gonna go through with Mr. Kim Sean, everything. So there are some things that he did left blank here. The first thing that I see that he left blank is, have you had an injury to the eye involving metallic object or fragment? So I will just ask him again if he's ever had that happen, because again, if that is the only area in our like soft muscle in our eye don't ever recover. So even if he had something in his eye, and he didn't let us know, it could be fatal for the patient and he could be severely wounded. So I'll double check with him, make sure that there's no shaving or anything else. The next thing, have you ever been injured by a metallic object or foreign object? He also left that blank. Again, I just want to make sure, because it can be dangerous for the patient to go inside of an MRI machine, let alone a room. Because again, the object could just come out of their body, or it can dislocate many other things, and it could cause more issues, rather than just coming in for an MRI for the brain. The next thing that the patient did cross out for female patients, but again, just to be safe as a MRI tech, I would go ahead and confirm, are you pregnant, or are you, any, just like that, I believe, just to be on the safe side. The next thing that we're going to be going through is we're going to go ahead and check any of the following. So again, I would go over these questions one by one. Do you have any aneurysm clip? And if they answer no, cardiac pacemaker. So something they also left blank was implanted cardioverter defibrillator, an ICD. I would go ahead and ask him that question, because again, even though some of them are MRI safe nowadays, it can mess up if they're not, and it's a whole another problem again. And we're just gonna go down electronic implant or devices, and we're just gonna go all the way down. For metallic stent, filter or coil, he did say yes. Again, we're gonna ask him about that question. Again, just double check with the physician or anything, and we're gonna go ahead and say it's MRI safe once everything is figured out. And then, are you here for an MRI exam? They did say yes. And other implant is a dental implant. So again, we're just gonna double check with the patient itself that it's not anything that is that can be pulled out from the patient's body, like again metal or anything that is not MRI safe or conditional that we haven't really gone through. And hopefully it's just some fillers and the patient is safe. But again, it would be easier once we're there, and the hospital does have some certain procedures for us to follow through. And signature of a person completing form, we would have Mr. Kim sign, and then form informative reviewed by. I'll go ahead and write my name on the form, and yeah, I would sign, and I'll have the patient again sign as well, date, and I would check MRI technologist, and yep. So the next thing that I'm gonna have open up only is gonna be the picture of the MRI. One is sagittal, one is coronal, and one is axial. So for those pictures, before we even get to that, the first thing that we're gonna have do is we're gonna have the patient go into their room, and once the patient, I'll help them into their room, and I'll have the key. I'll let the patient know that if they ever need anything, the key will be with me. And the only reason we don't want to leave the key inside is sometimes not all keys are, not MRI safe. So we'll just have it with us for safekeeping. After that, we're gonna guide the patient into the MRI room. We're gonna help the patient, sit down, and I'll explain to him what a squeeze ball is, when it'll do. I'll let him know that once he does squeezes the ball, I'll get notified inside the office, and I'll come out. And when you would want to use these is either when he's in pain, or he's claustrophobic, or if there's anything that's bothering him. And yeah, I'll come out of the room right away, and I'll come assist them. The second thing are headphones. I'll let them know why headphones are needed is because the MRI machine is very loud, and it could hurt hearings for most patients that are sensitive. And then I'll help them lay down supine. And once the patient is laying supine on the head coil machine, I'll go ahead and put pads around him or wherever he needs pads to feel comfortable, and I'll put some under his legs so he can be super comfortable. And once the patient is all cozy, I'll give him the squeeze ball. The headphones are on, and I'll go ahead and lock the head coil. And with that, I'll make sure the patient is lined up perfectly, and the crosshair is right on our glabellum. Sorry, I'm kind of like zoning out. And so it's going to be a perfect MRI of like our whole head. So the next thing that we're going to go is we're going to go into the room for our MRI, and we're going to start looking at the how to set up our patient's MRI scanning phase. Okay, so first thing that we're going to do is we're going to look at the slice. So for the first slice that we're looking at right now is the sagittal, the first slice, and then the second slice is a coronal, and the third slice is an axial. So for the sagittal slice, so the first slice that we're going to set up with our machine is we're going to do an axial slice. And now basically with the axial slice, we're going to make sure that it's parallel to the corpus callosum, and that it's going to be from our vertex all the way to our magnum foramen. Now the second thing that we're going to set up is coronal. Now the coronal is going to be paralleled to the brainstem, and it's going to be from our frontal sinus all the way to our occipital lobe. And now for the last but not least, it's the sagittal. And for the sagittal, it's going to be easy. It's just going to be our midline, and it's going to separate from right to left. And now in the middle of our procedure, we're going to be asking Mr. Kim, hey, this process is going to take about 3 minutes, and you should be all done in about 10 minutes. and then you're ready to go. So now, once the patient is all done and we're all done with our procedure, I would go ahead and escort Mr. Kim back to his locker room. And once the patient is back in their locker room, I would go ahead and unlock everything, and the patient can collect all of their belongings, everything that they need. And I would go ahead. Sorry, I'm just thinking. And let them know once the patient has all of his belongings, I'm not going to be in there while they're changing. I'll be kind of outside. And once the patient is out, I'll let them know, again, thank you so much for showing up today. It does mean a lot. If you have any questions, please let us know. Just to let you know that the exam will be sent out to the radiologist between 24 hours and 48 hours. That's when hopefully you'll be contacted. And after I set off the patient, I'm going to go ahead and, just make sure to document everything. If I have a little notepad just to keep reminders, like how the patient was inside when he was getting his MRI done. So that way I can document it into the RIS system. So now before the RIS system, I would make sure to upload all of the pictures into the PAC system, the PAC. And hopefully, once that's all done, I would go ahead, wash my hands. Obviously, you want to make sure that you're clean. I would go inside the room and make sure to change all the linens, pillow, pads, squish pads, and obviously sanitize the room to make sure it's ready for the next patient that does show up. Again, once I'm done, obviously I would have been wearing gloves before cleaning all of that. And once I'm done, take off my gloves, soap, water, wash my hands, and then hopefully, that is exactly how it's done. And yes, I'll be waiting for my next patient to arrive. And yeah.